Malaga Hospital is one of the oldest hospitals in Uganda, having opened in 1913 on Mualgo Hill. WBS TV brings you a series of stories on the historical development, challenges and future plans. Watch out for a series of these stories in our Sunday Prime News Live.
Many of the lodgers utilize spaces like this clinic area where you find lots of desks, empty desks, and they utilize them to sleep here because they are just free. Many others use even the wards to sleep there in the pretense of having patients to look after. It has been discovered that over 1,000 people masquerading as patients and patients' attendants sleep in Mualgo Referral Hospital every night because they have nowhere else to sleep. They sleep on verandas and on chairs at the assessment and screening centers of the hospital. Lodgers come from near and far and walk into the hospital to sleep between 11 p.m. and 1 a.m. in the morning. Hospital administration is aware about this and that lodgers claim to have patients to attend to, while others are alleged to have arrived late from upcountry for treatment.
People come and sleep, they all sleep down and they cover themselves. Men, women, children, they were just sleeping in the corridor as if something has happened. On the ward, that's why I tell you, you find one patient has about 5 people under the bed. You find patients actually 2 people on one bed, but these are not patients. 2 people are sleeping on one bed, they are not patients. They are exerting pressure on the tires of the bed, and the bed gets already very fast, which is a very big problem to us.
Some of the lodgers come from Kampala streets, night prayers, and others are unemployed and have no place to call home. Teenagers from Katanga and other hospital neighborhoods go to sleep in the hospital late in the guise of visiting their admitted relatives.
I'm from Kanungu. That is my home district. So I came here, I came to look for the job. They told me that I applied to Mualgo.
I was in Toronto, God told him to come and preach. So I'm a preacher.
I think they were down there. I don't know exactly where I'm staying.
Zishiamani simaze obanga dini kubanga zimbadde ntunya wana mawuli maze myaka nga 15.
Dr. Yarugaba Baterana is the executive director of the hospital. He says some people have been sleeping in the hospital for several years and have been tapping into the hospital resources, making it difficult for the management to account for these resources. They bathe and wash their clothes using the hospital water, use electricity to charge their phones, while some share meals with the patients.
Wasting water of the hospital is actually wasting your own money. People think that, that they are government. No, it's not who is government, it is us, the people. So when you waste water, you are wasting money that would have otherwise bought a drug which you would find in the hospital.
The fear among the patients is that some of these could be involved in criminal activity like theft of property. The hospital management claims in addition to this that there are people masquerading as health workers and spend the whole day loitering in the hospital, eager to help patients, but end up robbing them of their properties and cash.
If you're a doctor, at least bring your identity card, and you must be in uniform. But because most of these uniforms are also at the butchers, you see, you find somebody at the butcher putting on a white coat. At night, some of these people, I don't know whether they're the ones or their equivalent who come and put on those white coats. And the patients think that actually they're doctors. They are not. They're really not. A doctor can't come and fail to identify himself.
It is also alleged by members of the internal security of the hospital that some patients have more than 3 attendants on the ward. And when requested to leave during the doctor's ward round, they become abusive.
Some of them are so unruly that they don't want even to leave the patients. When we ask them, you have brought a lady. This lady is going to be examined. Now, why would you want all the people to see how your wife is being examined. They don't have an answer to that.
Now, the inpatient hospital management is contemplating starting operations to arrest all those who loiter and sleep in the hospital premises illegally. Harris Tembo, WBS, Mualgo Hospital.
Malaga Hospital is one of the oldest hospitals in Uganda, having opened in 1913 on Mualgo Hill. WBS TV brings you a series of stories on the historical development, challenges and future plans. Watch out for